Aloha mai kako, everyone. Oh, happy Aloha Friday. We are launching a new monthly segment, and we've been really excited in preparation for this in partnership with Papa Ola Lokahi. We are honored to be able to do this work with them to uplift the health and well being of Native Hawaiians everywhere we live. Tonight's episode is entitled the Kupu Ola podcast, and this is presented by Hale, who is Papa Ola Lokahi's Native Hawaiian Learning Institute. And so tonight, the podcast series, this will be a multi-episode series exploring how Hawaiian culture is intricately woven into the everyday work of health professionals in various fields, cultural practitioners, and community leaders. Our discussions will center on the importance of our cultural practices and protocols to promote health and well-being within our communities. So tonight we have two awesome guests new to the show. We're so excited to learn from them. Our topic is breastfeeding from a cultural perspective, and we will be joined by Kumu Kainoa. She is a associate researcher, an associate professor, director of nutrition and support, a faculty director of diversity, equity, and inclusion at the University of Hawaii Cancer Center. We had some of her colleagues on last month with Keola Mamo. And then our moderator tonight will be Kawehi, who is a population health specialist for chronic disease at Papa Ola Lokahi. So let's bring them up to the show and welcome them. Aloha.
Aloha
Aloha.
nui. Aloha.
Aloha.
Mahalo, Moana and Dana. That was a great introduction. So yeah, this is our podcast series titled Kupu Ola. And like Dana said, it is a mini series with Moana Nui Podcast and Papa Ola Lokahi. So I'm so happy to have Kumu Kainoa, who is one of my mentors. And before we do that, I wanted to do a little land acknowledgement and just mahalo the aina of Hawaii, which nurtures us and connects us to the legacy of our kupuna. And as we begin our podcast today and throughout the many months to come, we want to honor the Kanaka Maoli who have cared for this aina for generations, their knowledge and love for this aina that continue to inspire our work and strive to perpetuate their values of malama, aloha, and kuleana in our own lives and work. And I just want to bring into this space Kaka'ako because that is where Kumukainoa and I, both of our offices are. So just bringing that aina into this space and taking yourself there if you're on the continent or somewhere else in Hawaii. So Kumu Kainoa and I have worked together previously in my Master of Public Health career. She's been a huge mentor for me and my research in breastfeeding and baby and mommy health. So I thought it would just be really awesome to talk more stories with her today and do some talking story about breastfeeding and the importance and all that. So Kumu Kainoa, if you wanted to say anything else.
Yeah, no, just mahalo everyone for joining us. Mahalo to Moana Nui Papa Ola Lokahi for wanting to incorporate breastfeeding, a talking story about breastfeeding. I know we're opening Diabetes Awareness Month, so it's great to be able to talk about breastfeeding and all of its awesomeness.
Yeah.
So just mahalo and, Kawehi and I are just so glad all the time. Now that she's no longer a student and she's off embarking on this awesome career of hers and, working to uplift the Lohui, it's just an honor for me to be able to interact with her as a professional. So mahalo for bringing me into this space. I'm so honored.
No, mahalo. Oh, you make my heart so happy. Okay. So to get us started, I just wanted to, do the weaving of the culture and what we're talking about today. So I just wanted to share a little bit of Nu'akea, who is actually the akua or goddess of milk and lactation. Beckwith actually shares with us in Hawaiian mythology that Nu'akea was a chiefess who descended from Maveke Oahu. And when she passed, she was deified and became a goddess of breastfeeding and lactation. So Nu'akea is actually coupled with Lono, who is another akua, in a ceremony that helps boys wean from their mother's vaiu or breast milk. And this is because they have the hopes of asking these akua to help the child to prosper as they will not have the mana from their mother's vaiu anymore because they're being weaned off the breast. So that's just a little fun mo'olelo that I thought I would share. And also, we learned that Nu'akea's kino lau, or her other bodies, I think is the right term, is that she is found in the white sap of the palula, or the sweet potato leaf or vine, and also the kokea, which is a type of sugar cane. And both of these la'au are actually used to increase the supply of breast milk, and kea is another word for breast milk in Olelo, Hawaii. So by learning these mo'olelo of Nu'akea or our other akua, we're reconnecting with our roots of our culture and with our kupuna. So I think that's just so special. So that's just a little mo'olelo to get us ready to talk about breastfeeding today. And Kumu Kainoa, I think you wanted to do a little bit of shout outs if you think you want to do that here.
I just love all of the ike kupuna, the wisdom of our ancestors, and they were just so akamai. They were so smart, and this connection with the importance of hanai vayu, with breastfeeding, and the intentionality around it. That's kind of our first connection with ohana, right? Was from baby receiving the first vayu from mommy.
Mhm.
So it's just such an important, that ceremony, that connection, that intentionality of it. I think another nice ike kupuna to share to kind of add to the story of Nuakea is the olalo no eao ka'aihuna ika poli. So the food hidden in the breast, right? And that's breast milk. So it's just really awesome. And I just want to give a shout out to all of my kumus who've taught me, have, blessed me with the honor of learning this ike kupuna, especially kumu and Uni Jackson over at Kalahuyo Kapua Kalihi Valley. They've really been such great stewards, revitalizing all of our ike kupuna around birthing traditions, birthing practices, hanai vaiu. So I just want to mahalo all of them for passing on this wisdom to me so that I can incorporate it into the work that I'm doing. So I'm just really honored that we get to talk about this. And I just want to make sure to honor my kupuna, my kumus who've taught me all of this information. So mahalo kawehi.
I love it. Yes. Honor our kumus and our kupuna. Okay, so getting into it, just like my first question or the questions that we thought about talking. So getting into what is breastfeeding and what are the different ways that a baby can be breastfed. If you want to talk about that,
I think as we think about breastfeeding in the modern world, acknowledging that babies can get breast milk in lots of different ways. There's kind of a hierarchy that we're taught in like that, kind of the first way in which we want to be able to provide breast milk to babies is directly from the breast. But acknowledging that, in our modern society, moms, the birthing individual may not always be with baby. And so that second hierarchy is, providing them expressed breast milk, whether that be through hand expression, through expression from a pump, and then being able to provide that breast milk to babies, whether it be through a bottle, a cup, a spoon, or a syringe. And so there's lots of different ways in which babies are able to receive vai'u. Just acknowledging that, us wahine are so resourceful in being able to still provide that optimal source of nutrition during those early periods of life.
Yeah, definitely. I mean, the power of a wahine, right?
Yeah.
I just wanted to note there are recommendations regarding breastfeeding and they have been updated. So they still do, I should say who, the American Academy of Pediatrics and the World Health Organization recommend exclusive breastfeeding for baby, which is that the baby is only fed breast milk and no other liquids or solid foods within the first 6 months of life. And then after that, you continue breastfeeding along with introducing appropriate complementary foods for up to 2 years of age or longer. So it used to be 1 year, but it has updated to 2 years or more. Yeah. So,
and it's just so awesome. I'm going to just bring back in the Ike Kupuna, like our kupuna, they knew this. And so if you were to read some of the resources in Nane Ke Kumu, from Mary Pukui, they talk about this. And so the fact that, our guidelines are kind of aligning with Ike Kupuna, I think is just so awesome. And, the other amazing thing just about how the human body works is that just physiologically, babies, all they need is what mommy has to provide them for those first 6 months. So there isn't a need to give them anything else. And babies, for those first 6 months, they should be fed on demand. However much babies want to eat, that's how much that they should be fed. And so it's just this really beautiful time that's this dynamic between mommy and baby that provides everything that they need. And then at about 6 months, physiologically, and the babies, their digestive system is able to start to digest other types of foods. And then just their muscle development, they're able to hold up their heads. And then some of their reflexes that are really important for safety for baby when they're younger, but there's reflexes related to their tongues, those start to die down. And so just physiologically at about 6 months, they're ready to start to receive other types of foods. And then the other just really amazing thing about breast milk, I said for those first 6 months, it provides, all of the nutrient needs that you have. And breast milk, it's like the perfect substance for your body. All of those nutrients like iron, they are in the perfect state for our body to be able to draw from it, So we refer to as bioavailability. It's in that right state that our body is able to absorb it. With babies, we kind of, when they're in utero, they get all of the iron stores that they need. And so for those first 6 months, they really got all that they need. Just our bodies have been physiologically made to do this. And so then at that 6-month mark, they recommend to start to add other foods, especially iron-rich foods, zinc-rich foods, because that's when those stores are starting to deplete. And, just to put a plug in again about Ike Kupuna, one of our best first complementary foods for babies is poi. I could go on and on and on, but we could probably save that for another day. But it's amazing all of the wisdom that was carried forth from our ancestors that were really health promoting, health protecting that we can do in those first years of life.
I love it. I know. My first food was poi. I think many of ours in Hawaii was poi, and I love that Ike Kupuna. I know you.
Mix in the breast milk with the poi to get it to the right consistency. It really is just a great vehicle, and just to highlight, the value, the especially when we think about poi, when we think about breast milk. I mean, it has all these properties, probiotic, really, really good for our guts. And so that's the benefit of both of those foods. But especially if we're starting off first, there's just so many benefits in regards to the composition of how, in regards to the nutrients, it's the perfect distribution, macronutrients, so our carbohydrates, our fats, our proteins. And the other beautiful thing about breast milk is that breast milk is it changes. It's always adapting to the stage the baby, it's adapting to the stage of, the time of the day. And so like when you first deliver the milk that is, it's called colostrum. It's a really special type of breast milk that's perfect for those first few days that really just set the stage, helps with building immune system and all of those things. And then after a few days, your milk composition changes, the fat changes, and all of that. And so it completely changes. And then the other thing that's really great, if you were to look at composition of milk between the morning and at night, your morning breast milk is going to be higher in water. Your evening breast milk is going to be higher in fat. And when you just think about the time of the day, it's so amazing. And you don't necessarily get that sort of adaptations like on the day that you can get from other sources that may be fed. And so, that would be like your infant formulas.
Mhm.
So the infant formulas, they don't have that adaptation that breast milk is able to do now. But just important to make, there's a very important place for infant formula. A fed baby is what we always want. And there's certain contraindications, certain disease conditions, certain medications where it would not be recommended to breast milk. But for the majority of situations, breast milk is the optimal source of nutrition. Just for those few reasons. I mean, I think we're going to talk about some other benefits, but just thinking about the nutritional benefits and its adaptation. I mean, it's just so amazing how it evolves over time to meet the needs of baby.
So cool. Oh, every time I hear that, I'm like, that is just the human body, right? It's just so
Yes.
amazing.
Yeah, it
Um,
is.
yeah, so I know you touched on some of the nutritional benefits and how, your breast milk changes. I believe too, when you're sick, the antibodies go to baby. Is that correct?
Yes,
Okay.
yes.
So even like that, you're giving baby more antibodies. You're building babies so that baby can thrive in the future, I think. And that's how I look at breastfeeding and how beautiful it is. But to go on, I know you like hinted at it, but I wanted to talk a little bit more about how breastfeeding, like with the nutritional values that you talked about, how it can benefit like our Native Hawaiian population, our lahui, because I know there's so
Yeah.
many, and I know we
Yeah,
can talk
no,
about
I
that.
know. We could go on and on. I think maybe because we're just talking about immune system benefits, I think it's really great to, in certain instances where mothers may have had to have a C-section,
Yes.
being able to breastfeed is very important and helpful with helping with that immune system boost because baby wasn't able to travel through the vaginal canal and things like that. And, you know, there's strategies now. A lot of policy changes have been implemented in the hospital setting
Mhm.
to even make it easy for mommies who have to have a C-section to still be able to breastfeed. There's specific strategies in the hospital setting. It's referred to as baby friendly hospital
Yes.
initiative. There's 10 steps. And those strategies have been found to be really successful at promoting and supporting breastfeeding so that no matter which mode of delivery, you can still be successful at that. So just kind of that, immune system boost and how you can keep doing that through that connection between mom and baby. I know we're here, wanting to bring awareness for diabetes. Evidence shows that women who do breastfeed, who do provide human milk to their babies, they have a reduced risk for diabetes. It's about a 30% reduction in risk for diabetes. And there's also a relationship between duration. So the longer that you breastfeed, the greater that protective benefit is to reducing your risk for diabetes. And so it's really great that the guidelines are kind of this longer duration recommendation for breastfeeding. It's really great that we're seeing that because that's where we see the benefit being yielded. The longer we provide breast milk to babies, the better. And then, in addition to diabetes, there's lots of other conditions, breast cancer, endometrial cancer, cervical cancer. I am at the University of Hawaii Cancer Center, and reducing the burden for cancer risk here in Hawaii and the Pacific region and the communities that we serve is very important. And so, reducing risk for those types of cervical cancer are important, but we also know reducing the risk for diabetes, which is also a risk factor for cancer, is important. Relatedly to that, for mommies, it also can reduce risk for maternal postpartum depression. It's been found to be really helpful with, because when you are having a baby, all the physiological, all the hormonal changes, there's a lot of amazing things going on with our bodies. And, after delivery, there's a lot of physiological changes and hormonal things that are going on. And breastfeeding just helps with that regulation and is found to be really protective, reducing risk for postpartum depression. And so that's also really important. And so that's kind of on the makuahine, the mother's side. And then when we think about for babies, in addition to the immune boost being that optimal source, cognitive development has been found to be improved in those babies, or higher, I guess you can say, in those babies who are breastfed. They've even done studies where they've looked at IQ, 11 years later, and they found that their IQ levels are significantly higher. And, just kind of those things. There's reduced risk for allergies, ear infections. There's a lower risk for weight or obesity later in life. And then you can't get away from that bonding, that experience between mommy and baby. The other benefit that I've heard too from, those who specialize in kind of the development around the face is breastfeeding directly from the breast also helps with the development of the muscles and everything because of the act of suckling and things like that. So it's really amazing how this one behavior, and they say the first 1,000 days. And so that's the time from conception, I think it's still 2 years, so that toddler period is probably one of the most pivotal times to be able to set us up for future health and well-being. And, we just listed off a ton of them, and that's just from breastfeeding, And so it's really amazing how much of an impact that this one, behavior and practice can have for both mommies. And I think that's the other really awesome thing. It's just it's benefits for mommies and babies. And I think sometimes we tend to focus only on the benefit of the baby. And I know that like our mothering thing to do is like, it's all about putting forth all of our every ounce of us into our mother, like my sign says in the back, there's no hood like motherhood, right? But we also have to remember that we, mommies, right, are the birthing people matter and are important. And breastfeeding is malamaing ourselves. That's taking care of ourselves and our health and our well-being, mental health. So that's the other thing that's really exciting. It's a twofer, it's a two for one. This one behavior is just amazing for both. So anyways, I guess Kawehi, you're going to have to stop me because I could go on.
I don't want to stop you at all. Oh my goodness. I love that so much. I mean, right? Snaps all around. I love it. Yeah. So, but because of all of those, with all of those, I should say, benefits and for mommy and baby, that's so amazing. I didn't even, when I started my research on breastfeeding, I thought it was just for baby, right? But then I like started researching and learning from you, and I was like, wow, there's like all these benefits for mommy. But when we look at the research and look at the numbers, we see that a lot of our Native Hawaiian mommies aren't breastfeeding for the full 6 months or even for 8 weeks. So the numbers are really low. So I guess my next question for you is, what are the barriers from keeping our Native Hawaiian mommies and birthing people to not breastfeed or choose not to breastfeed?
Yeah, no, I think that is such a complex situation.
Yeah.
I think, and it's a situation that not necessarily us as individuals can control.
Mhm.
I think systemically there's a lot of things in place that make it really difficult for, our birthing people, our mommies, to be able to be successful at breastfeeding. I think there's, we can't ignore, like the historical trauma that's surrounding, us engaging in cultural practices. Like breastfeeding is that's an indigenous, that's a like, besides from being a health promoting, I mean, that is like the core, every civilization across the world is breastfeeding. And it's, historically for lots of different for lots of different reasons, that the benefit and the cultural appropriateness of it, has been lost. And so there's also even kind of a generation where, they were told that breast is not best.
Mhm.
And, with the, the development of infant formulas and all of these other things. And like I mentioned, there is an appropriate place for infant formula, and it's always important that our babies are fed. But there was a lot of misinformation around that. And, so we have a generation where families weren't breastfeeding.
Mm-hmm.
And so you don't have that inner family support system to help. Because, breastfeeding sometimes, for many, I mean, I've had 4 keiki, and 3 out of my 4 keiki, I had to go and do a kahea to my breastfeeding, like my breastfeeding expert friends to be like, I need some kokua. Like, I need some help. I can't really figure out this latch. And so not necessarily, many ohanas don't have that. I mean, I think we're starting to see a change, and more ohanas are breastfeeding. It's becoming more the norm. We're seeing it. And so having that inner support system, having those maternal members of the family, but even having the kane, them, knowing and supporting their wahine in being able to provide breast milk is really important. I think with, we all got to work. I mean, cost of living is, it's not getting any lower. And so, and not everybody, I recognize that somebody like myself is in a position of privilege. I have my own office where I can lock my door. Mahalo. I got a Halloween.
Oh, nice.
And so not everybody has a door, in the room. Some people, they may have to go to, and it's great. We have all of these pods, that are popping up. They call them different names based on who's the organizing entity. But they're essentially these pods for mamas to be able to express their breast milk in a safe and clean environment that is not a bathroom. Like, that is relatively recent legislation, relatively recent policies that was like, no, you need to create a space that is not a bathroom, because, we should be treating expression of breast milk like food, because it is.
Yes.
It is not something that you go and you lock yourself in a bathroom stall. And so that's relatively a recent, piece of policy and legislation that has been changing the workforce environment to start to make it easier for working mamas to be able to provide express breast milk to their babies when they're away from work. But, I think one of the things that we're so behind the curve on in this country, in the states of this country, is that there is no paid maternity leave.
Mm-hmm.
And we are the only, I guess, what do they call them? High income developed countries where that is not the case. I mean, in many other countries, you get paid maternity leave for a year for the mothers. And then the kane get paid paternity leave, because they recognize that if we invest in these beginning points of life, it's going to yield significant health benefits. It's going to be significant economic benefits. And so the fact that we don't have paid maternity leave when women, birthing people have babies is also makes it very difficult. And so again, I'm in a place of privilege. I work for the University of Hawaii and, I've accumulated leave. And so when I take off leave, it's paid because I've accumulated that leave. And that's not necessarily the situation for many people. And so they're having to make this decision. Do I take leave? And then I have no money to put food on the table for my ohana so that I can, or do I just work and, let's see what happens. And there's lots of things out there about what it is, about what helps you to make breast milk.
Mm-hmm.
And it's a supply and demand. Like, that's ultimately what it is. You need to be expressing, you need to be breastfeeding in order to keep your supply up. And so it's not about how much water you drink or how much oatmeal you eat. Like, there's all kinds of things that you can find on the, when you Google it or whatever your search engine of choice is. But it really comes down to a supply and demand. If your body is not being told to breast milk because there's to produce breast milk, there's going to be a decrease. And so that's like the choices that women have to make. And I just really wish that women didn't have to make that. I really wish that society prioritized this really like special period of time for our ohana, and I think that could be one of the ways in which we can lift up the lahui, and we can lift up all everybody. That's an equity. That's a health equity charge to make it easier for ohana to be able to, really create the best foundation for the next generation.
Yeah.
So I don't know. I think, Kawehi, let me know if I might have missed something, because I know you're very mocked to all of this too, having recently graduated. But if there's anything that you remember, or, that you think that we should add, I think, I guess one thing I do want to, in addition to the paid maternity leave, that also I think is very important, those initial days when after you deliver and when your milk is starting to come in, you're starting to establish this relationship with your baby. Excuse me, when you're out of the hospital and you don't have the nurses there to help you, having places in the community to be able to go to for supports, but also just your hospital being breastfeeding friendly.
Yep.
And I know that there's a lot of people who are working within the state of Hawaii, for example, within our breastfeeding state, Hui, to really support our hospitals to be able to integrate practices that are really eating friendly. The baby friendly, those 10 steps, that's kind of the ultimate designation. And we do have a few hospitals that have that designation, and especially in, other islands, not just on Oahu. So I think that's really great for making sure, other mamas in the Pai'aina, not just here on Oahu, are able to get that, best support. But I know that there's a lot of people working across the state who are trying to help all the facilities to be able to integrate as many practices as possible to make their facilities, because really, that for those first hours after delivery are super important for being able to establish a great breastfeeding relationship between the birthing person, the mommy, and the baby, and having hospital support staff who are trained to be able to provide that support is also pretty important to being able to be successful at it. So it is like you could draw a picture and you would have arrows going in there and circles. It would be one of those complex, very, it's just such a complex thing. But I guess that just signifies just how important this year is.
Yeah, totally. Yeah, if anything, if I was going to add, it's having that resources in the community of, because in Hawaii, we have a lot of areas that are rural. And if you don't have that resource in your community, you're having to drive hours or something, to the next WIC clinic or wherever. So just having more community members who are able to help and provide that source, because like you mentioned, I think it's the first 3 to 7 days is when complications happen and early cessation of breastfeeding starts and early introduction of infant formula. But if you're able to combat that with having those resources, that'd be really awesome.
Yeah. I think a lot of, different programs exist that incorporate different types of support, peer counselors, lactation counselors, IBCLCs. So if you kind of have these multiple levels of resources, in addition to just more people who breastfeed in the ohana, you have your internal support system. I think all of those can be important safety nets. And, there's a lot of organizations that are trying to do their best. I mean, Healthy Mothers, Healthy Babies, I really want to give them a shout out, because they're really trying to increase their reach across the Pai'aina, not only through physical, and, they have, I think, their bus. I've seen it. I was in Waipio and I saw the bus. I was like, oh my God, there's the Healthy Mothers, Healthy Babies bus. But then also the incorporation of telemedicine and things like that. Those are all like valuable resources to just be able to figure out all of these different ways in which we can support Ohana. And then, you mentioned WIC. WIC is a federal nutrition support program specific to women, infants, and children. Breastfeeding is a major component to that. And WIC clinics are throughout the Pai'aina. And so it's a real opportunity. And I really want to, also do a shout out to one of the WIC clinics, Waimanalo, led by Amber Granite. And she's really, trying to integrate a lot of our Ike Kupuna into the support that she gives to Ohana and, and then we just have great, really supportive leads who just run the state WIC office. And so really just trying to figure out strategies. And that's just another great, when we think about sustainability, these programs are already existing within our community. And so how can we identify opportunities for these programs to be able to serve the communities in the way that works best for them? And so,
Yeah, totally. Just finding those resources and knowing where to go. But we actually, Kumu, Kainoa, and I worked on resource document of different breastfeeding resources that we actually shared with Moana and Dana. So I think they will post that somewhere for you folks to reference if you ever need help with breastfeeding resources or anything like that. There's both in like continent resources but many of them are Hawaii based, but we did note if any have like Zoom options or anything like that. So that's a cute little resource that we made. So moving on from the barriers, I know there are many and it changes from wahine to wahine, like what your ohana situation is, your community, all of that can play a role in your breastfeeding abilities. But I think I wanted to talk a little bit about shining a light on the resources and opportunities that we do know can help and to support mommies or breastfeeding people who want/can breastfeed their babies. So if you could just talk a little bit about that.
Yeah, no, I mean, I think it starts from the simplest thing with making breastfeeding it's just a normal behavior.
Yeah.
And that you don't have to cover up to breastfeed when you're in public. Like that is getting us to a point where people are normalizing that this is a perfectly acceptable way, because we don't cover up when we eat our food. Right. And so, I think getting us to a place where it becomes that normal behavior. And so that there isn't this sense, and not to say if people want to cover up, I mean, I'm not to say that, I don't want to, I guess the point that I'm making is that it just becomes the normal behavior and that there is no shame in wanting to be able to breastfeed your baby. I think that's really important to just kind of establishing this baseline of support, not just with the birthing person, right? It shouldn't just be the kuleana of the birthing person, of the woman to want to do this. It really is the kuleana of everyone, the kuleana of Kane, especially to be able to support our wahine to be able to do that. So I think then, just kind of it's not the individual. We need to think beyond that. So having that support structure within our ohana is kind of really a great. And so to be able to see those ohana who demonstrate that, that's a real opportunity. I think we highlighted some of the different programs that are trying to increase their reach, through multiple channels, increasing opportunities for telehealth to be able to support. And, recognizing that when somebody is reaching out for support, that is it's urgent. That's not something that we'll get back to you in 48 hours. Providing wahine support for breastfeeding, that is an urgent situation that needs to be done, as quickly as possible to be able to help. Because really, it's just oftentimes the situations are helping with adjustment in the way the latch is, helping with positioning, maybe having to release some of the pressure because of engorgement. And so these are things that you want to, it's an urgent situation. And so I think organizations who kind of incorporated that into their system of practice when people come in requesting support, and I think that's a strategy that I really, I mahalo those organizations for treating it in that way. And, also for, as a result of legislation, Affordable Care Act and things like that, you know, breast pumps are necessity. And so many insurance companies will cover breast pumps to help wahine with expressing breast milk. So make sure to get in touch with your insurance carrier, regarding those policies and what type of pumps that you're able to get. And then really figuring out the breast pump that works best for you. When as you can imagine, with gadgets in the world, there has been lots of advances in breast pumps. And so you don't have to feel like you're plugged into a wall with wires, like looking like the alien or something like that. Like, it is amazing how far we've come. But, there's also just the simple hand one. And that's what I used for my last baby. I just felt like it worked best. I didn't need a plug or a battery or my phone, Wi-Fi.
Yeah.
All I needed was my hand. So you kind of just figure out, and of course you have hand expression. So, but I think the point is just be familiar with your insurance carrier, what's available. And of course, there's lots of medical providers now who, just have an open dialogue with your medical provider. I have a really amazing pediatrician. Just going to give a shout out to Dr. Lynch from Reese Pediatrics. And there's lots of Dr. Lynch's, lots of Dr. Reese's out there. And when I talk about like having a sense of urgency, I was telling her, and she was like right there with me, helping me out. And so there's that sense of urgency that we want to support our mamas. So just lifting up our medical providers who are really, have prioritized this. And so those are, other examples of support systems. But, I think starting with talking story with your ohana about breastfeeding, it's a great conversation starter. I've learned a lot about my mom and my grandmother, and, especially since, like my mother's generation, is that generation where it was like, it was not okay to be Hawaiian. It was not okay. But then recognizing when she would talk to me about things that like my grandmother did, and I'm like, oh wow, like that's like, those are like our traditional, like, so you were doing it, but you didn't even recognize it in that way. Right. So it's like our families, our ohana were resilient to be able to carry it forth, even though it may not have been obvious that we were carrying those practices. But yeah. And so I think it just helps you to understand the inner strengths that we all possess within our ohana and our resilience. I think that's really important. And, breastfeeding is just an example of that resilience as a lahui.
Yeah, totally. I mean, when I had the conversation with my mom, you learn so much about, the barriers of, okay, like having a lactation room or being in a position where you have your own office and you can close your door and pump breast milk. I know I was 50-50 formula and breast milk. And then my sister was fully breastfed because my mom had her own office. So she could pump at work and all that. But yeah, I mean, there's so many, it seems like now that there are coming more resources and opportunities for our mommies or breastfeeding persons who want to breastfeed or who can. But yeah, it's also good to have the resource of infant formula, right? Like we talked about.
Yeah, a fed baby is what we
Yes.
want. We want a fed baby. And
Yes.
so, it's going to be whatever works best for ohana. But, I think if we, can, as a lahui and as our ohana, shoot, for the best, but ultimately, whatever is going to work within the ohana is important. We want babies to be fed. But, just knowing that if we can, providing breast milk, breastfeeding is really the most optimal source. And it's optimal not just for baby, but most importantly for our birthing people, for our wahine, our breastfeeding person, because so often, right, it's baby that becomes the focus.
Yeah.
And we need to also bring in our mommies, our wahines back into the forefront and reminding them that they're also important and breastfeeding is taking care of them too.
Yeah. Yep. Totally. Ah, I love it. But I guess I know we only have like 9 minutes left, or not even now 8. I don't know how it went. The hour went by so fast. But I guess just as like a closing mana'o, like if you have anything, like anyone you want to shout out or anything that worked for you when you were breastfeeding your keiki, I don't know. What do you want to talk about?
I mean, I think, yeah, just acknowledging my kumu, I am here as a result of, and then just all the amazing women in my ohana, starting from my mother, my grandmother, all of these just amazing people. And so just mahaloing them for, instilling the foundation that has allowed me, I wanted to be able to be in a position where I could serve the lahui. And I'm really excited that the universe has allowed me to find this as a way in which I can serve. So I just want to mahalo all of those amazing people in my family, and not to forget the Kane, my father and all of those things. So really I'm
Yes.
honored to be representing all of my ancestors. And I'm really proud to be and representing all of my kumu, my advisors, everyone who believed in me. But of course, I want to make a shout out to my ohana, especially my kane, kahekili, having that support system. And he was like, yeah, you got this, and, he just supported me on my breastfeeding journey, no matter what. And I think that's really important. And you know what the really beautiful thing is that all my keiki, like that's just normal to them, and I'm still breastfeeding my 2-year-old and that's just normal. They're like, mommy, come on, you got to give him Chi-Chi already. Like, what's the deal? And so
Love
my
it.
children are going to be growing up where
Yes.
that's what you do. And I think that's just a way in which we start to change the paradigm. Is we start within our ohana, and then as more and more ohana start to take that stance, ohanas become communities, and then communities, they instill policy changes and systemic changes, and it really just works its way up. And so that it's making it easier for everyone to be able to make those choices. And so it's kind of fun. We talk about how it's not only at the individual level,
Yeah.
but it really can go both ways. We can start from that individual ohana as more and more ohana, right? And then it goes bigger and bigger. But then as we make those bigger systemic changes and policy changes, it funnels through and then it affects individuals and ohana. So it really is a bi-directional, it's a kako thing, right? I
Yes,
don't think
it's a
any
kako thing.
kako thing, no, don't just leave it on the kuleana of the, it really is a kako thing.
Yeah, totally. And I just want to touch on, the kako thing and the ohana system, because from my research or from our research, we found that having that social support system, or, having your ohana, your friends, your auntie, your uncle, or not your uncle, but, somebody that you can talk to, even your uncles, who knows? I don't know. Somebody who can support you in your breastfeeding journey, because yeah, it gets hard and, there's difficulties, there's barriers. But when you have that support system, we saw that women are more able to breastfeed to the full 6 months and beyond, to the full 2 years and even more. So just having that, and yeah, I love that. It's a kako thing because it really,
Yeah,
right?
yeah. And I think actually one more thing I want to
Yeah.
do another shout out is because, I recognize that there's not very many health professionals who look like us, right? Who come from our communities. But,
Yeah.
that's starting to change, right? And there's more kanaka who are in these positions of being able to support ohana in this way. And it's really great because it makes us feel like there's a place for us. And so I also want to just acknowledge like Breastfeeding Hawaii and their organization and Amber as well, because, it allowed for a group of us to be able to get Indigenous breastfeeding counseling training And I think that was also really important because it just revitalized the importance that we can bridge our Ike Kopuna with what we learn in, our Western field of practice. And so having more of those types of trainings and certifications and really just lifting up that value and being able to really provide patient ohana support is really great. And so I just want to mahalo, for the opportunity to have that training. And I know that they've been looking for other ways in which to bring that training so that others can benefit from that. And so I think just normalizing that as a way in which to provide, and basically our cultural practitioners are also important practitioners to be able to support in these health behaviors. It does, it really, I guess it goes back, it's a kako thing, right? It's definitely a kako thing.
Yep. Yeah. Oh, yay. Well, I think that was all my questions and all that. So yeah, I just want to mahalo you for talking stories with me and joining the podcast today.
Yeah, no, mahalo for thinking of me. And I'm excited that it's kicking off Diabetes Month. So this is great. And mahalo Papa Ola Lokahi and mahalo Moana Nui for creating this space for us. And then, of course, Kawehi, mahalo you and just all of the good stuff that's come out of all the opportunities we've had to interact.
Yeah. Yes. I mean, it goes right back to you, all my mahalos and all that.
Yeah. Thank you so much for tuning in. Big mahalo to both of our guests for being part of tonight's episode. And we thank everybody once again and have a great, wonderful weekend.
Mahalo. Mahalo nui.
So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will.
If this the land of the free, it was a freedom then. When they annexed Hawaii and called it Cedar Lands, without any type of payment and no signing off. Called themselves a republic in 1894. 1.2 million acres overtaken from the Native Hawaiians. When they resisted, the West retaliated in violence and erasure. The Hawaiian language is banned as part of colonialism's plan to expand,
Stuck between a rock and a hard place. Multiple bombings of Kupu Ola Bay as a part of their ongoing war with Asia. Used it as a place for target practice. No consent or compensation. Colonizers call for annexation. The work of all the locals. School will never let you know. So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will. We will.
So if you put Hawaii in a perspective, well, Black and Asian history is interconnected. Considering the fight with the Pacific, then of course, versus Asia, they was treated as a middleman for war, but didn't let the Western colorism run its course, cause dark skin was a sign of dignity to core. The land was taken in the name of capitalism, when prior to it was an actual kingdom. Clap back at the system.
Stuck between a rock and a hard place. Multiple bombings of Kupu Ola Bay as a part of their ongoing war with Asia. Used it as a place for target practice. No consent or compensation. Colonizers call for annexation. The work of all the locals. School will never let you know. So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will. So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If we won't tell it, we will. We will.